Hi, everybody. I'm Peter Hollmann, Chief Medical Officer for Brown Medicine. Let's talk today about what to do when you're not feeling well. As we know from the CDC and other literature, the symptoms of coronavirus or COVID-19 can be many. They can be fever or chills, cough, shortness of breath, loss of taste or smell, but they can also be other symptoms as well. So how can you tell when there's something you should do about these symptoms? First of all, we want to be very careful to minimize the spread of disease, but we're also trying to balance people going on leaves or quarantine or getting testing that isn't really necessary. So we want to take a common sense approach combined with common sense protections. But remember, it's never a good idea to come to work with a new potentially infectious illness. So don't say it's just a cold, thinking you can go to work. Just a cold means you stay home. So what are symptoms of concern? Well, they're anything that's new. If you have a fever, that's an absolute restriction to going to work. And if you've had recent unprotected COVID exposure, there's need to quarantine, even if you're feeling well. Symptoms that are unlikely to be COVID, unless you've had one of those exposures, are the symptoms that are not new to you. So if you have asthma and the trouble breathing that you're experiencing is typical of your asthma, that's probably not COVID. If you sneeze and have a runny nose and you have allergies at this time of year, that's probably not COVID. Same thing with diarrhea in a person that has irritable bowel syndrome, a headache in a person that has chronic headaches or migraines. In other words, anything that is a symptom typical for your presentation of a chronic illness may not or probably is not COVID. Now, let's not forget something else. There's a lot of talk about vaccines, but there's a really important vaccine that's available today. Get it now. There's no need to wait. It's called the flu vaccine. Thanks very much for spending some time with us. I'm Peter Hollmann, and this has been a Brown Medicine Minute.